So, looking at yet another complication of diabetes mellitus, we are looking at what is known as diabetic retinopathy. So, once you hear retinopathy, retina is the eyes, So, let me just give you guys a short story before we continue. Now, for people that have diabetes mellitus, they are having high levels of sugar in the body. Do you understand? Now, this sugar can get deposited in blood vessels. Retinal artery is a blood vessel too. You understand? So this sugar can get deposited in the retinal artery too, causing a lot of issues in the eye, like blood vision. Right. So it's one of the most serious microvascular complication of diabetes mellitus. Why? Because the eye has only one blood supply, retinal artery. Once it is affected, that's all. Okay. So it leads to a cause of what? Blindness worldwide. So what is this diabetic retinopathy that we have been talking about? It's a progressive eye disease caused by damage to the blood vessels because you have high sugar levels and because sugar is being deposited in the blood vessels in the eye. So over time, the blood vessels, they start getting weak. They can burst up, they can leak, become blocked, all right? They grow abnormally, leading to vision impairment and blindness, right? So what are the stages? You can have the background one where you just have microaneurysm, small hemorrhage. You have the proliferative. This is before the blood vessels start growing anyhow. The proliferative one, this is when the blood vessels are growing anyhow. The diabetic macular edema. This one is when fluid is leaking into the macula, causing blurry central vision. Okay? So risk factors. If the person has had diabetes mellitus for a very long time, you have had high glucose levels in the body and it's poorly controlled, hypertension and high cholesterol levels, the person is pregnant, genetic predisposition. All right. So symptoms to watch out for is if the person has blood or a patchy vision, the person is seeing floaters, having difficulty seeing in the night, sudden vision loss. Diagnosis is all those dilated eye examinations, retinal imaging and fluorescent angiography, then annual screening for people that have diabetes mellitus. So treatment, laser photocoagulation just to seal any blood vessel that is leaking. All right, anti-vascular endothelial growth factors to reduce, the abnormal vessel growth. All right, then vitrectomy surgery for advanced cases with bleeding or retinal detachment.